For this video, we are going to look at the anatomy of the female reproductive system. If we are going to scheme this model, which is a mid-sagittal plane of the female internal pelvic organ from the most anterior to the most posterior, we will find the pubic symphysis, which is a cartilaginous joint between the two pelvic points. Then we have the urinary bladder, followed by the uterus and the vagina, the sigmoid colon, the rectum, and the anal canal. Today, we will put the female reproductive system into more focus, and we are going to divide it into internal genital organs and external genitalia. First, we will discuss the female internal genital organs, which are the ovaries, the uterine tube, the uterus, and the vagina. The first thing are the gonads, or the female gonads that are known as the ovaries. Both the right and left ovaries are located in the ovarian fossa. This yellow structure shown here is the ovary, which is responsible for producing hormones such as progesterone and estrogen, in addition to producing the female gametes, which are known as the ova. Then we have the uterine tubes, or the fallopian tubes, that are extending on both sides of the uterus, allowing for the transportation of the ova from the ovaries to the uterine cavity. The uterine tube has four distinct parts: the infundibulum, the ampulla, the isthmus, and the intramural part. The infundibulum ends with a finger-like projection or processes known as the fimbriae that extend all over the ovary to capture the released egg. Then the ampulla, which is the elevated part of the uterine tube. It's also the longest and the widest part that acts as the normal site for fertilization. Then we have the constricted part of the uterine tube, the isthmus, which is enter the uterine horn. Finally, the uterine part, which is a short intramural segment of the tube that passes through the wall of the uterus and open into the uterine cavity, is the intramural, as the name indicated, intramural inside the muscle of the uterus. However, we cannot see it in this model. It can only be seen in a coronal section of the uterus. Now, let's move to the uterus. It has three important parts: the fundus, which you can see if you draw an imaginary line from the opening of the fallopian tubes, and everything above it will be the fundus. Then you have the body of the uterus, which is the main and the largest part of the uterus. Finally, you have the cervix, which is the lowest and narrowest point of the uterus opening toward the vagina. So again, we have the fundus, we have the body, and we have the cervix. The wall of the body of the uterus consists of three layers: the innermost mucus layer, which is the endometrium. It's involved in the menstruation. The middle layer, or the myometrium, made mostly of smooth muscles. And finally, we have the outermost serous layer, which is the perimetrium. The space within the uterus is known as the uterine cavity. You can also divide it into a body cavity ending with internal os, then a cervical canal ending with external os. The function of this uterine cavity is it's the space that allows the travel of the sperm from the vagina to the oocyte and the implantation of the fertilized ova, if any exists. So, posterior to this uterus and anterior to the rectum, we have a potential space that is known as recto-uterine pouch, or the pouch of Douglas. It has a clinical significance, as the blood will accumulate in this area in case of ectopic pregnancy or inflammation, while anteriorly between the urinary bladder and the uterus, this space is known as the vesico-uterine pouch. It serves as a potential space for the expansion of the urinary bladder or for the expansion of the uterus during the pregnancy. Before we move to the vagina, let's see the ligaments that are associated with the female reproductive system. The first one, which is the largest one, is the broad ligament. You can see a part of it over here. This ligament is a double layer of the peritoneum extending from both sides of the uterus to the lateral wall and the floor of the pelvis. It keeps the uterus in position. Now we finish the broad ligament. For easier identification of the rest ligaments, you will first identify the fallopian tube or the uterine tube. The ligament that is anterior to the fallopian tube will be the round ligament. The ligament that is posterior to the fallopian tube will be the ovarian ligament. Now, the round ligament extends from the anteroinferior aspect of the uterine tube to the labia majora, and it prevents the posterior displacement of the uterus. Posterior to the fallopian tube, we said that we have the ovarian ligament, which connects the ovaries to the uterus. The other ligament that's associated with ovary is the suspensory ligament, which is a double fold of the peritoneum surrounding the ovarian blood vessels. We cannot see it in this model because it's just a continuation of the broad ligament that has already been removed from this model, but you can identify it on those blood vessels, which are the ovarian vessels that supply the ovaries. So it will be in this position. The other uterine ligament that is not shown here is the uterosacral ligament. It attaches the cervix of the uterus to the sacrum. Again, we mentioned 5 ligaments. We mentioned the broad ligament. Then, by identifying the fallopian tube, we identified the round ligament and the ovarian ligament. And finally, we see the suspensory ligament, which is supposed to be at this area. Now let's move to the last part of the internal genital organs, which is the vagina. The vagina simply is a musculo-membranous tube extending from the middle cervix of the uterus all the way to the vaginal orifice. It is found anterior to the anal canal and posterior to the urethra. Also, we can see that the recesses of the cervix forms the fornix of the vagina. We have an anterior vaginal fornix and a posterior vaginal fornix. Also, we have a lateral vaginal fornix, which is not shown in this model. Now, we can see that the posterior vaginal fornix is associated with another structure, which is this is the recto-uterine pouch. Now, the function of the vagina, it serves as a canal for the menstrual fluid to come out. Also, it forms the inferior part of the birth canal. Okay, so by this we are done with the internal genital organs, which are the ovaries, the fallopian tube, the uterus, and the vagina. Now let's move to the external genitalia, which is also known as the vulva. It includes the mons pubis, which is a fatty eminence anterior to the pubic symphysis. Then we have the labia majora, the labia minora, which encloses the vestibule. We also have the clitoris, which is an erectile organ located where the labia minora meets anteriorly. We have the urethral orifice and the vaginal orifice. Now, the vestibule of the vagina is the space surrounded by the labia minora, into which the orifices of both the urethra and the vagina open. The space forming the diamond-shaped area between the pubic symphysis anteriorly to the thigh laterally and the anus posteriorly is known as the perineum. So we can say that the vulva is a part of the perineum.